So, good day ma'am. Today I will be performing the ambulation. So, in the first step in ambulation is you reviews medical records for the patient, most recent activity experiences, and also records the weight. So, in my case, the weight of the patient is 45 kilograms, and the recent activity is she can tolerate ambulation. So the next step is reviews medical record for any history of risks of orthostatic hypotension. So orthostatic hypotension is a condition with a low blood pressure that when you sit up from a lying down position, the patient will feel dizziness or lightheaded, or maybe even cause the patient to faint because of the low blood pressure. And then the next step is the next step is reviews healthcare providers orders of the patient for activity, and then notes the mobility or weight bearing restrictions of the patient. So in my case, there is no weight bearing restrictions of the patient, and then she can tolerate the mobility of herself, and with my assistance also as a student nurse. So the next step is determine best time to ambulate, schedules around other activities. So the best time to ambulate for the patient is morning. Assuming in my video it's morning. So next is the check patient's environment for barriers or safety risk. You need to check for this step, double check, because there might be the barriers of the hospital bed might be raised up by the nurse to avoid risk of falls when when the patient is by herself. So meaning when ambulating, you need to put it down the safety barriers for ambulating. And then next is identify patient using at least 2 identifiers. So you identify the name and the birthday. And then next is perform hand hygiene. So prior performing the assessment, always you need to perform hand hygiene in order to deter the spread of microorganisms. So in the next step, you assesses patient's readiness to ambulate. So you need to assess for the baseline vitals of the patient, so that to check if the patient has a low blood pressure, meaning she will have a orthostatic hypotension when the patient sit up from a lying position. And then check for her pulse rate, her respiratory, and overall the vital signs. And then assesses ROM and muscle strength of lower extremities in bed if necessary. So in my case, the patient has a normal ROM and muscle strength lower extremities in the lower extremities. And then ask the patient if he or she is tired or experiencing pain, and also determine the source and severity of the pain. Administer analgesics if necessary. So in my case, the patient does not feel pain, and she is not tired. Apparently, she is energized to perform ambulation with my assistance as ordered by the doctor. So the next step is you assess the patient's level of response to commands and views regarding health and willingness to participate in the activity. So in the next videos, you will observe that the patient is willing to participate in the ambulation while educating her. And also in the video, in my in the video of performing the steps, later on you will observe that the patient's response to commands is satisfactory because she knows and she understands what I'm saying, and she responds it to me. She responds to me whatever I say or advise to her while ambulating her. So in the next step in performing the ambulation assessment is you assess for the patient for any deficit that may affect his or her ability to follow the instructions. So in my case, in the patient's case, the ability of the patient to follow my instructions has no problem. As observed in the video, that the the patient is able to respond at my commands. So explains the patient how to prepare for ambulation and explain the benefits of it and reasons for the activity. Considers patient's beliefs and values regarding health. Educate the patient with the assessment. So ma'am, karon mag-ambulating ta. So ang ambulating is kanang i-exercise yung muscles for you to exercise as well, exercise your muscles by walking, ma'am. So syempre suportahan ti ka sa likod na butangan ti ka gate belt sa imong waist para na ako'y gunitanan sa imong para sa imong safety pod if matumba ka or kapuyon ka or unsa ba or something like that. So karon ma'am, patindugon ti ka, and then before ti ka patindugon, i-assess na ko imong vital sign, imong blood pressure, imong pulse rate, imong respiratory rate para in order if require or if nakaabot ba ka sa or kung kaya ba nimo ang ambulating. And then also ma'am, patindugon ti ka, and then I will wait for you to assess yourself if kaya ba nimo motindog or kaya ba nimo mulakaw. So kung dili ma'am, kung di nimo kaya, pwede mo tayo ibalik kung pahigda, and also natay wheelchair for you to sit kung na times na kaya nimo pero dili pagtitindog ana. So okay ta ma'am. Okay, good. So the next step is you assist the patient from a supine position to the side of bed. So first is you raise head of the bed and places bed in low position and places non-skid footwear on the patient, stands on appropriate side of bed, turns patient into side facing self, and then stands opposite patient's hips and turn to face patient and far corner of bed, and then places feet in wide base of support, and then places arm properly under patient's shoulder, and then places other arm around patient's thighs. And then the next thing is you move the patient's legs and feet over side of bed, and then pivots the weight of the patient to allow patient's upper legs to swing down and elevates patient's trunks to upright position. So the patient is in a supine position. So first, put the right hand under the shoulder and then the other hand around the hips, and then put the patient in the sidewards towards you. Then crunch the knees of the patient. Then support the patient around the neck and the knees, and then pivot sitting upwards. So the next step is you allow patient to sit for a few minutes and flexes and extends patient's feet and moves legs up and down and checks blood pressure if necessary. Have patient relax and breathe if he or she feels dizzy. Returns the patient to bed if necessary. So mo ni ang ginaingon na check for blood pressure because there might be a orthostatic hypotension when you position the patient in a sitting position. And also when she feels dizzy, when he or she feels dizzy, this is the sign that there is a orthostatic hypotension, and you need to check the blood pressure and return the patient in a lying position because it might cause the patient to faint when it is not assessed or you force the patient to perform the ambulation. Step in ambulation after you assess the ability of the patient to ambulate is you attaches the gait belt, and then next is you help the patient to stand up with shoulders back, and then assesses ability to bear weight and balance. And then next is you return patient to bed or chair immediately if he or she is unsteady when standing up and obtains additional help. Touching the gait belt, ma'am. Excuse me, ma'am. Mag-attach yung gait belt, ma'am. So the gait belt now is attached. So instruct the patient to hold you around your shoulder. Ma'am, guniti ko, ma'am. And then grasp the gait belt while the patient is standing up. Sige, ma'am. 1, 2, 3, tindog. And then position right beside the patient while transitioning for the ambulation. So, ma'am, ganito lang ko, ma'am. Then, don't forget to do not let go the gait belt of the patient. So, proceeding to ambulation. Okay. So, the next step is places a IV pole on side of infusion, instructs patient to push the pole while walking, and then empties drainage bag if necessary. Ensure bag is carried appropriately and that there is no tension in the tubing. So in my case, there is no drainage bag in my patient, so that's it. So the next step is decides with patient how far to ambulate, and then stands on appropriate side of patient and slightly behind. So this step is you need to perform thoroughly because there might be accidents or sudden actions or sudden stumbling of the patient. So you can move fast and you can support the patient quickly. And then grasp gait belt supports patient appropriately through first few steps, and then assesses strength and balance before continuing the ambulation. Ambulating the patient, you need to support the patient by standing behind only the patient and supporting the gait belt while ambulating. So, nako, ma'am. Balik. So this next step is reacts to the patient if he or she will start to fall. So first, grasp gait belt with both hands and then stands with feet apart for support. And then pulls patient against self and then slide patient down legs slowly to floor. Does not risk personal, and then you ask the patient to bend knees and lowers body with the patient, and then stays with the patient until the help arrives. While ambulating, when you observe the patient is a rumbling or katumbaho na siya, so that's the time you support the patient to sit down. So first, grasp the gait belt when positioning yourself behind the patient, and then instruct the patient to lean with you while folding her knees slowly. So, ma'am, kung di ka po nakawa, pwede tayo mulingkod. So, pag mulingkod ta, lean sa kuha, ma'am, while folding your knees slowly, okay? 1, 2, 3, lean. And then, assuming this is a wall, sorry kung wala sa space, ma'am. So, after that is you call for help and wait for it. After the help arrives, returns patient to comfortable position in a bed or chair, and then perform hand hygiene. And then the last step is you records time and distance ambulated, changes in vitals during the after the ambulation, and patient's tolerance in the patient's chart. So you need to assess for the vital signs of the patient after the ambulation. So so that you can determine if the patient has a abnormal blood pressure, abnormal pulse rates, or uh, ab- uh, low respiratory rate after ambulating. Basig gihangok siya taman tungod sa ambulation, or nalipong na siya then gipugos niya, or di jud bali medyo dili kaya sa patient, or weak pa ang iyang body during ambulation. So that's all, ma'am. Thank you.